Hi, I'm Dr. Mihir Shah, and today we are going to discuss about the various causes of crooked teeth. As we all know, crooked teeth is often considered to be genetic, but often crooked teeth is a sign of a deep health-related problem. So we are going to discuss about few of these factors which are environmental, which leads to crooked teeth. Okay, so first we are going to discuss about mouth breathing. Okay, what is mouth breathing? As we all know, in today's fast-paced world and in city like Mumbai and all the developing cities of India, there is a very high amount of pollution, and this pollution lead to very high amount of chronic respiratory illnesses, cough, cold among children. These children often end up doing mouth breathing because their nose is congested. They can't breathe. Breathing is the most important thing for their body. And if they are not able to breathe from the nose, they'll start doing mouth breathing. Now, what is it in mouth breathing which leads to crooked teeth? As one is doing mouth breathing, their tongue posture is lowered. Okay, for a proper growth of our face and jaws, our tongue should be on the roof of the mouth all the time. Roof of the mouth meaning the palate of the upper jaw or the maxillary jaw. Okay, so as you can see, this is the upper arch, this is the palate. Our tongue should be touching the palate all the time. Okay, so when the tongue is touching the palate all the time, the maxillary jaw is widened, it's proper U-shaped arch, and at the same time, if the tongue is on the roof of the mouth, the lower jaw also grows forward, upwards and forwards. However, during mouth breathing, the low posture of the tongue leads to constant pushing of the tongue on the teeth, and the lower jaw starts a clockwise rotation, that is a vertical growth of the face occurs. Now this vertical growth of the face leads to a long face appearance. At the same time, the lower teeth are crooked, they are malaligned, and it gives us a perception that the upper teeth are in front. Okay, so this is due to mouth breathing. Now also in this world today, the working due to working a lot of working women, the children are often weaned early of breastfeeding. Okay, and they started doing bottle feeding. Now bottle feeding is something which is not natural. What bottle feeding leads to more amount of low tongue posture. At the same time, it promotes more amount of mouth breathing. Now, this low tongue posture, as already discussed, leads to something called as a tongue thrusting or constant protruding of the tongue on the teeth, which leads to crooked teeth. At the same time, it promotes mouth breathing. And mouth breathing creates more amount of cold and cough issues, more amount of respiratory tract illness. How does that happen? Our nose is for breathing and his mouth is for eating and speech and all the other stuffs. So when we breathe our air from the nose, the air is filtered through the maxillary sinus. There is a very important gas known as nitric oxide, which is only released in the nose. This nitric oxide gas disinfects all the germs which are in the air and then gives us a sterile air inside our lungs. However, anybody, a child or adult who breathes from the mouth, has a more amount of allergens in their air or the allergens in their respiratory air which is taken inside, and this leads to more amount of cold, allergy type of issues. So this mouth breathing is like a vicious circle. So a child who is breathing from the mouth has more amount of crooked teeth. At the same time, a child who's breathing, who's bottle fed at an early age, they don't have to exercise their lower jaw while doing bottle feeding. A breastfed child has to constantly exercise their lower jaw, constantly get their lower jaw ahead while suckling of the milk. This constant exercise of the lower jaw helps in the proper growth of the lower jaw and proper development of the bite, proper development of the occlusion of the upper as well as the lower jaw. However, this doesn't happen during bottle feeding. This leads to more amount of crooked teeth. A child who is bottle fed has a more amount of non-space dentition. Now, what is this non-space dentition? Ideally, in a normal children who are breastfed for a longer time usually have a spaced out dentition. This spaced out dentition meaning there is good amount of spacing around 3 to 4 millimeters in their milk teeth which can accommodate their permanent teeth. Okay, a child who's having less spaces or inadequate spaces or milk teeth which are joined to each other like this and not like this, they tend to have more amount of crooked teeth coming one below, one behind the other. So this is called as a crowded dentition in primary teeth. Okay, so in order to prevent that, according to Indian Association of Pediatrics, the child should be breastfed up to 2 years of age and beyond. So this help in a proper growth of the face as well as the jaws. At the same time, the teeth will come in good occlusion or good bite, and they may not need braces. Thank you.